Chief's Convenience. If you can't find what you want, let us know and we'll get it.
Prevention and control. We have looked at everything that we've received from the ministry and from the INFPQ where we receive our documentation. We've derived our policies and updated everything based on that. So we have a lot of information available for staff and also for community organizations to help direct them with this change. So we know that there are so many benefits to having the masks, as we've seen through the pandemic, but we also know that there's detriments in some ways. And so especially in long-term care environments, we know that we have some people who rarely leave and who've been seeing people care for them with masks on for a very long time. So the benefit versus the risk was weighed, and because of everything that Dr. Michigan said, there seems to be much greater benefit to removing them at this point. So that's what we've done. We're focusing on increasing our hand hygiene, our other respiratory etiquette measures like sneezing and coughing into your elbow or into a tissue, and making sure that our staff and all of the families are aware of these changes. So we have safety in place still through IPNC, but we're ready for this move.
So it has been exceptionally challenging on our residents because this is their home and they've been living these last couple of years seeing people with a mask all the time. So just this morning I went over to see how things are going, and you should see the light on some of their faces that they're almost asking like, who are you again? Because they don't even recognize us. So it instantly is changing the effect of how they're feeling. But we do know that as challenging as it was to get everybody into the place where we were wearing masks all the time, that it's going to be just as challenging to go the opposite way. So we did speak with staff leading up to this change. We've contacted all the families of the residents in long-term care and let them know this was coming, but also just to get a gauge of how they were feeling about it. So for the most part, the residents and families are very happy that this is coming. Like we said, it's been a long couple of years. Val mentioned being able to eat together again, like eating is a very social thing, so that's exciting. And then for the staff, we left it as like at your comfort level. So again, going over this morning, some staff are still wearing masks, and we know it's just gonna take some time to get everyone comfortable with this again. But still, we're very excited and very happy to be at this point.
So we've been working throughout the pandemic very closely with KMHC because we have the two residence facilities. We have the Turtle Bay Outdoors Lodge and the ILC, Assisted Living Services. So we've been working really closely with them, and we had a collaborative framework that was developed. So we make sure that we verify all of our directives and everything with public health. We always make sure that we get all of the information that's needed on the infection prevention and control measures. So at the T-Bell and ALS, we are a little bit different in that our residents are very independent and they're out and about and in the community. So for us, it's going to be more that the staff, the visitors, and the people coming into the lodge will no longer have to wear masks, because the residents haven't been wearing them for a little while now. They weren't required. So we're also asking everybody to be very respectful for those that wish to still wear masks, because like we said, it's a transition, right? So people were used to doing it, and we want to make sure that people respect one another if somebody still wishes to wear a mask.
And so the areas that will still have to wear masks will be in the clinic. So if you come to the clinic, it's still required to wear a mask. And also in short-term care, you'll still be required to wear a mask to be able to come and visit, and the staff are still required to wear masks in these areas. And also the home care nurses who will be going to the homes to do care, direct care, will also be required to wear masks. So, it's a good change, and it's gonna happen in steps with our masks. But right now, anybody in acute care services still requires to wear a mask. Yeah. And if visitors that are visiting long-term care still want to wear a mask, the mask will be available for them. so it'll be their choice, and we'll make sure that we have masks available for them also too.
One thing I would like to add is that although we're not required to wear masks within the long-term care facilities, when they go out into the community, into a resident's home to provide home care services, or the life skills workers from ALS, when they go out into residents' homes, they will still be required to wear masks.
Well, and I think that's the rationale behind the stepped approach, just to see what the repercussions would be as we peel back the factors that were put in place. We are anticipating and we're watching for it, essentially. But what, as mentioned by Valerie, although we're stepping back, if there is an outbreak, we do have clear criteria for that, we would resume mask requirements again.
And also too, is looking at it too, right? During the pandemic, that partnership happened, right? So we're asking, visitors and staff, if you're sick and not well, please don't come to work or don't come visit, so we can help, not spread any germs that can come into hospital. So that's one of the messages also too.
But one of the other reasons we're comfortable with it is because we know that the severity of COVID, the cases of hospitalization, and just the cases in general, we've seen a decrease in those numbers. So it is a good time to be doing this now.